Good morning. This is Dr. David Stempoliski, one of the co-editors of the Fellows in Training ACC blog. We're here at ACC Legislative Conference 2015. I have the pleasure of speaking with Dr. Cribbs today from the University of Alabama. Dr. Cribbs, I understand you went from pediatric cardiology to adult congenital cardiology. Please tell us what the Legislative Conference and Advocacy means for you.
Well, I think it means a lot to adult congenital cardiology. I think one of the things that a lot of people don't realize is that the folks who come to the adult congenital cardiology clinic have very complex congenital heart disease. It's actually estimated that about 85% of patients who come to see us have complex congenital heart disease. So that includes things such as tetralogy of Fallot, transposition of the great arteries, Fontan circulation, and other single ventricle physiologies. That said, a lot of those patients have had a number of operations, and what we've learned from children and neurodevelopmental outcomes is that a lot of those patients go on and don't finish school. They therefore don't get great college educations and therefore not great jobs. And so as a result, they don't have a lot of money. And so the Affordable Care Act has been a huge development in that regard. A lot of those patients wouldn't be able to see us in the clinical setting, even at UAB, a private institution, a public institution, if it weren't for public insurance availabilities. So I'm here really to learn more about that and what goes on in that regard here on the Hill, and just to kind of see what the general murmurs are around the cardiology world. I think as pediatric cardiologists, we often feel like we're not represented, but that's clearly not the case, as I've learned here in just the past couple of hours.
What do you see happening in the next 10, 15 years in the field of congenital cardiology?
Yeah, I think it's just going to continue to grow. There's an estimated about 20,000 new adult congenital patients per year that are stepping out of the pediatric clinics and into the adult world. But you think about all the people that you know who are training in adult congenital cardiology, and it's very few. In fact, in the state of Alabama, there's only one. In Mississippi, there's only one. But there are far more patients than that particular physician can take care of. So I think we're going to see just a huge burden on these cardiologists to take care of these complex patients. And hopefully a growing number of fellows who become interested in it.
Well, I'm glad to see a lot of support from the congenital cardiology perspective, particularly as you mentioned, a lot of the kids are growing up and we need adult cardiologists to help deal with the pathology. Well, thank you very much again for joining us today. To see more coverage of the ACC Legislative Conference 2015 in Washington, D.C., please visit us at www.youtube.com/fitsonthego.